Hi, it's August of 2020. It's been quite the 6 months we've just had. However, I'm very excited to share some information with you that you can't get in school. And how many of you out there would like to be happy and healthy for the rest of your life? And how many would like to avoid painkillers, muscle relaxants, anti-inflammatories, and all the rest of late-stage heroic medical intervention? I hope it's a lot of you. Put your hands up. So today I'm with Tracey Bucci, and I'm going to share my information with her, and you get to watch while we do that. So thank you for being with me today, Tracey.
Thank you for having me.
And what I want to share with you is that I found a method of going to the cause of all the musculoskeletal problems, the aches and pains that everybody suffers going through their life. And they don't know the cause of it, so they end up taking the painkillers and muscle relaxants and so on. They do what they have to do to get pain-free. And so I found a method that goes right to the cause of the problem and gets rid of it permanently. Quickly and permanently. So can I take a minute and just tell you a little bit about my past?
Yes, absolutely.
So my name's Sylvia Shackleton, and I was a registered nurse. I worked in all the hospitals in Toronto, and then I went to chiropractic college, became a chiropractor, and then I went through naturopathic college, practiced as a naturopath. I had dark field microscopes and so on. But I still didn't know the cause of people's problems. So I kept searching, and I studied applied kinesiology. And applied kinesiology looks like this. These are all the muscles down the page, and just to the right are all the organs that they're tied into. Now, people understand nowadays that all the muscles and organs are tied in together because they share the same nerve supply and blood supply and lymphatic drainage and so on. So they're all connected. The body's all connected, and it's always talking to its different parts. And the reason why I got so excited about applied kinesiology was because I saw a demonstration, and then I myself had cerebral palsy at birth, and I had a lot of neurological problems, and I had indigestion, bloating, congestion in my head. And the very first time I went to school to learn how to do this, the fellow I was partnered up with knew these reflexes were on the inner thigh. And so he grabbed me, he went in here, and he worked these reflexes. And within 5 minutes, all my bloating was gone and all my fogginess was gone. And I said, wow, I've never come across anything that effective or that easy. And so I said, that's it, I have to learn this. And so this is the method you use for testing all the different muscles. So you test them, and then you know how the organs are functioning. I'm just showing you the muscles there. So you can see, there's no test later, don't worry, you don't have to memorize any of this. So after 4 years of doing that muscle testing and working on everybody, I found out that I was giving the best treatment I had ever given. And I was very happy with it. And I did that for 4 years on 2,000 people. And I went through all my files, and I found out everybody had these 8 dysfunctions. Now, they had hundreds of other dysfunctions, but these 8 were common to everybody who came through the door. It didn't matter if they were babies, little kids, big kids, teenagers, old age, men, women, didn't matter. They all had these 8 things. However, they didn't know they had those 8 things. So I started fixing the 8 things. And when I did, all their musculoskeletal problems would go away, because I'd say, okay, now I'm done my treatment. The thing you came in with, how is it doing? And they go, oh, it's gone. And I go, wow, I don't have to do anything. It's done. And so I found out the 8 things were the underlying problem that kept all the other things symptomatic.
Mm-hmm.
So one day a lady came in, I did the 8 things. She went out. Next thing I know, she's back in my waiting room, and I say to her, "What's the problem?" And she says, "Well, I lost my treatment on the way to the car." And I said, "Okay, don't worry about that. Come right back in here. I'll redo it for you." But while I'm redoing it, I asked her, "What happened on the way to the car? Did you fall down? Did you eat? Did you drink? Did you get bad news? Tell me what happened." She says, "Nothing. I just walked on level ground to the car." So now, right away, I knew walking undid my treatment. So I had her walk in front of me. The hips were normal, the knees were normal, but the feet were like this.
Mm-hmm.
So I said, "There's a problem there." So I worked all the muscles on the back of her calf, the anterior tibial, posterior tibial, peroneus. I worked on the Golgi tendon apparatus inside the muscle, and I did the origins, insertions, stimulated the circulation, lymphatic drainage, and so on. And then I said to her, "Now, you can go to the car, but if you have another problem, come right back. I want to see what it is, because I can test right away and see.
Mm-hmm.
It is or it isn't." She didn't come back for 3 months. When she came back, she says, "Wow, that's the best treatment you ever gave me." She says, "It lasted all this time." Well, usually my treatment would last about 3 weeks,
Right.
2 to 3 weeks,
Mhm.
not 3 months. So I said, "Oh my gosh, what I have to do now is I got to work on everybody's feet and legs."
Mhm.
And when I did, everybody's treatment lasted 3 to 4 months.
Wow.
So I said, the underlying flaw is in the foot.
Mm-hmm.
So, have you any idea what goes wrong with people's feet?
No.
I mean, just take a guess.
Their arches might fall.
Yes, exactly right. So here's how the foot should look, like that.
Okay.
And here's how it looks when they come to see me.
Okay.
So the reason, have you any idea why they fall? I'm going to show this,
Not wearing
show you guys this.
proper footwear.
That could be a reason. One of the reasons is 100,000 years ago, we didn't have pavement, we didn't have sidewalks, we didn't have cement, we didn't have hardwood floors, and we didn't have any ceramic or terrazzo or anything like that. We just walked on soft ground.
Okay.
So the foot accommodated itself to the soft ground. But now we're slamming that foot down 20,000 times a day. Even a couch potato walks 5,000 steps a day on a hard surface, and eventually the holding elements, the muscles, ligaments, tendons, and fascia allow the foot to fall down.
Okay.
Make sense?
Yeah.
So when the foot falls, the ankle rotates in, the knee rotates in, but the hip rotates out. And when that does that, it destabilizes the pelvis, so it's not level.
Mm-hmm.
And that causes tipping, tilting, and rotation in the lumbar spine. And that continues its way up, and it causes upper back, shoulder, and neck trouble. And I'm just going to show that picture to the camera so that people can see that. And so when we have this rotation in here, it impinges on the nerve supply, and it causes this tipping, tilting, rotation. It impinges on the nerves, and it shuts off the abs, the glutes, and the quads. And so then the body looks like this.
Right.
So if you go out walking, you go along the trails or Costco or Walmart, you see a lot of this configuration, but you don't see much of this.
Mm-hmm.
And it even happens in kids. They walk on hard surfaces, they get flat feet, and they get that whole body distortion. Now, when these muscles are turned off, this muscle, it's called the iliopsoas, it becomes too tight.
Mm-hmm.
It's on a different nerve supply, and it's just doing its job. It's taking up the slack
Mm-hmm.
that's left by these muscles that aren't working. And this muscle attaches to all 5 lumbar vertebrae. When it's too tight, it's compressing the lumbar spine. And that is destroying the discs in between the vertebrae. And that's why people get shorter as they get older.
Okay.
So my mother used to be an inch or two taller than me. Now she's 2 inches shorter.
Wow.
Now this muscle has another layer. It's like the biceps, there's two. And the upper layer goes all the way up and attaches in the base of the diaphragm here. Everybody thinks of muscles as going from one bone to another and causing this kind of movement. But in this case, this muscle attaches in the fascia at the base of the diaphragm.
Okay.
So these two muscles now, the quadratus and the iliopsoas, are too tight. And they're literally pulling the diaphragm apart. And the diaphragm is a big balloon-shaped muscle between your chest cavity and your abdominal cavity. When this pulls it apart, there's a hiatus there. That's a fancy word for hole. Through that hole passes the esophagus. That's where you swallow your food. And also the big vessels from the heart, the aorta and the vena cava, go down through that opening. It's supposed to be snug like this. But when these muscles are pulling on it, it pulls it open like that, creates a big opening, and then the stomach rides up. Any idea why the stomach would ride up? The reason is the esophagus is a muscular tube. And as long as the stomach is down here, there's traction on the tube.
Okay.
But the minute the muscles are pulled apart and the opening gets big, the traction is pulling on the stomach and pulls the stomach up into the chest cavity.
Okay.
So now the stomach, instead of being underneath the diaphragm, is up here. And when you eat a big meal in the evening and your stomach's full of food and then you lie down, the stomach is compressing the heart and pushing it up against the spine. So we know from Chinese medicine that the body's very economical. It doesn't run all its organs at the same time. It literally sends energy from one organ system to the next every 24 hours. Now at lunchtime, right here, noon hour, all the energy is in the heart and circulatory system. So that's the time to do heavy work. Dig your garden, shovel the snow, pull up the carpets, vacuum, move furniture. That's when you do it. That's the best time.
Okay.
As you follow the clock around to midnight, the least amount of energy is in the heart at that time, the heart and circulatory system. So you don't do your heavy work at midnight. You should be in bed at 10 o'clock and asleep at midnight. So what happens is people eat their big meal here, their stomach's up in the chest cavity, then they go to bed, they lie down, the stomach compresses the heart, and it's influential in causing heart attacks. And a while back, I used to cut death notices out of the paper, phone the family, and say, was your family member on digestive aids? Tums, Rolaids, pink liquid, the purple pill, the Zantac, and whatever. And they would say, oh yeah, they were being treated for digestive disorders. And when the stomach is up in the chest cavity and the esophagus is only 3 inches long instead of 10, they get acid reflux into their throat, and that's why they're taking the digestive aids. So this is what your bloodstream looks like before you eat a meal. All the red cells are all separate and independent. And then after you eat a meal, the fat in your food, and I'm not talking about good fats, bad fats, or anything like that, just the fat in the food, whatever it is, goes into the digestive tract. It's absorbed by the lymphatics, and the lymphatics go through the lymph nodes and they end up back in the bloodstream. So now you got fat in your bloodstream. It makes the red cells sticky, so they stick together like this. And here's the problem with that. The red cell is 7.2 microns in diameter across here. And the red cell has to pass through the capillary, which is only 6 microns in diameter. So this red cell has to change shape like that to get through.
Right.
And then it pops out the other side like a balloon coming out of a tube.
Mhm.
But when they're all attached like this, they don't approach one at a time and they can't go through.
Right.
So now all the organs that have these small capillaries are not getting their blood supply, including the heart, the liver, the spleen, the kidneys, the brain. They're not getting the blood supply they should. And this is the underlying cause for a lot of disorders that are causing a lot of trouble. So I had a fellow come to me one time. He'd been in the hospital. They took out his gallbladder, and then they took out his IV. They said, "You're fine. You can eat and drink now." And so he tried to, and he couldn't swallow a drop of water or a bite of food. And he came to see me, and he said, "Well, I'm supposed to use these glass rods and open up my throat, put them under the tap, stick them down my throat." And he was doing that every day, and it would pry his throat open, and then he could get the food down, but his stomach would churn and churn and churn, and 20 minutes later it wanted to empty. It couldn't empty downward because the duodenum was trapped
Right.
in the closure, in the flap, and then he would throw up. So every meal he ate, he threw it up. So I went into my AK book. I found this page. I looked under the diaphragm. It says, in hiatal hernia, you must first pull the stomach down out of the hiatus. Use a heavy downward pressure with the patient in the vertical position as if you were trying to pull a cork out of an inverted champagne bottle. So I put him up against the wall. I taught him how to breathe so his diaphragm would move. And as he breathed out and the diaphragm came up, I reached in and pulled the stomach down.
Okay.
After that, he ate normally from then on.
Okay.
He was
Wow.
just like totally brand new. Now I just wanted to share some information with you about the feet. How do we correct those feet that are going flat all the time? So mostly when you get orthotics, they have you put your foot in a mold. It could be plaster, it could be foam, you could put it on a tray of pins, but they're basically taking the shape of your existing foot.
Right.
And so in this case, they pour plaster in the mold, they make a plaster foot, a facsimile of your foot, they put it in a vise, and then they start laying the materials over top to make the orthotic. However, it fits your broken down foot, and it doesn't correct your foot.
Okay.
So this is just an example of somebody who did this. It says 80 years of foot care carries sense and tradition. And this is a picture of all the molds and the facsimile of the foot, the plaster foot.
Okay.
And so when I make the orthotic for people, I have a moldable plastic orthotic. I put it in the oven, I make it soft and pliable. Then I work on all the muscles. I put the arch back in the foot, so there's a beautiful arch there. Then I mold the orthotic up to the bony arch. Not the soft tissue, the bony. So
Okay.
it's architecturally correct. Then it goes in the shoe, immediately turns on the abs, the glutes, the quads, and releases the psoas. So now they can eat and drink and digest and have full function. They can get up off the chair, they can walk, they can run, they can do all these things. So I'm just going to share with you something about the spine. The spine has these big curves in it. And this big curve, what do you think causes that? Any ideas? Well, I'm going to share this with you.
Okay.
These vertebrae are not square like bricks. These vertebrae are wider on the front than the back. Wider, wider, wider. See that? So and that's what creates the curve.
Okay.
So the curve goes the other way here, and then it goes the other way here. But it's all by the shape of the vertebrae. So we'll just show that. So now we have this vertebrae in the spine, and it's got all these rings on it. That's the fibers that hold the gel in place. And this is the disc, and the gel is in the center of the disc. And this is expandable. So when you lie down, you're actually taller than you are when you're standing or sitting.
Mm-hmm.
You're taller lying in bed. And this is designed to bear weight. So when you're little, this disc has arteries, veins, lymphatics, and nerves going into it because it has to grow from the size of a little baby up to a full adult.
Mm-hmm.
But once you become an adult, the arteries, veins, and lymphatics and nerves in there disintegrate and disappear because they're not needed anymore.
Okay.
It's reached the size it ever needs to be.
Mm-hmm.
So now when you injure your disc, you don't feel it because there's no nerve there.
Okay.
So a lot of people, they have a disc injury, they don't know they have it.
Mm-hmm.
But they know they got a pain running down their leg.
Right.
They just don't know where it's coming from.
Mm-hmm.
So this is a picture of all the discs in the vertebrae,
Mm-hmm.
where they're supposed to be. They're situated where they're supposed to be. And this is what happens when you sit and you don't have a cushion behind you keeping your curve in. You just sit in a chair with a straight back seat and you just push yourself up against the back of the chair, which thousands and thousands of people do.
Right.
And you're in the theater, you're in the car, you're in the bus, the train, the subway, whatever. You're just making a straight back. And besides, your mother told you all your life, sit up straight. And so you do, and you take the curve out of there. And when you take the curve out, you didn't change the shape of the bodies of the vertebrae. So they're still wider at the front.
Right.
See?
Mm-hmm.
And now they're pushing the gel out the back of the disc. It's pushing on the spinal cord, and it's causing you sciatica or back pain or muscle splinting.
Okay.
Sometimes it can even just be pain in the foot, but it's coming from here.
Mm-hmm.
So you treat and treat and treat the foot, and you wonder why it doesn't get better,
Right.
because we're not going to the cause in
Right.
a case like that.
Right.
So this is a picture that shows a normal disc and one where the gel has been pushed through into the spinal cord area. I'm just going to show you that. And then this is the cause of it, where you sit like this and there's no curve in there,
Mm-hmm.
or you work like this and there's no curve there.
Mm-hmm.
So this could be plumbing, heating, wiring, carpentry, vacuum the floor, dust, anything like that, and this is sitting. And so those are the things that cause it. But you don't get pain right away, so you don't know it's causing it.
Mm-hmm.
You don't know. So this is a picture of the spinal cord, the spinal vertebrae, and all the organs. And one lesion at L5S1 can cause problems with the nerve supply to the liver, gallbladder, pancreas, spleen, small and large intestine, kidney, urinary bladder, and reproductive organs.
Mm-hmm.
So if you have problems with any of those organs, it can be a lack of proper nerve supply.
Right.
So this shows you an ordinary disc that's in a good situation. There's nothing wrong with it. But the pressure is going backwards from the curve in the back, from not sitting right. So the pressure is going backwards. It finds a weak spot, and it just keeps pushing through like this until it's pushing on the cord.
Mm-hmm.
And then if you go to the physio or the guy at the gym or something, he might tell you, do the Mackenzie maneuver. So they get you to bend back up here. But bending back up here doesn't fix this here.
Right.
You actually, this shoulder neck bending here doesn't fix this because the spine is infinitely mobile. Every segment has its range of motion.
Mm-hmm.
So the way we fix this aching back, here's the problem, and this is the solution to fixing it. Now this solution works really much better if you have orthotics in your shoes, your abs, glutes, quads are strong, and your psoas is normally relaxed. And then you get into this position. And we're just increasing this curve slightly. I'll let you look at that longer.
Okay.
You put your knee on a cushion. You lie face down. You can watch TV, read a book, talk on your phone, use your remote, anything you want to do. You're not wasting your time here. But if you're in excruciating pain, you should do this 20 minutes night and morning.
Okay.
If you have no pain at all, like you might do it 5 or 10 minutes a week,
Right.
just to reset things. So this is a fantastic treatment. And I never did this as a chiropractor or a naturopath because I was told in chiropractic college, never increase this curve. Never, never, never increase that curve. And the reason they said don't increase it is because at the back of the vertebrae, there are facet joints, and they're like shingles overlapping. And if you just increase the curve there, you can jam them and cause pain.
Okay.
But the pain isn't harming any critical structures, like the disc, like the spinal cord, or like the nerve root. It's not harming any critical structures. But they don't want you to have that pain, so they say never increase that curve.
Right.
And so I would have never thought to increase it because I was told for 5 years don't do it. But I have had a herniated disc 25 times, and I now know that if I sit wrong or I do anything wrong, I just get right into that position and reverse it immediately.
Okay.
And 3 things actually heal the fibers. Because when you're in this position here, you're opening the discs at the front. You're creating a vacuum in there because it's a closed system. And that vacuum sucks the gel back to the front of the disc. However, there's torn fibers in there. And you heal up those fibers with vitamin C, gelatin, and sulfur, which you can take every day. And in a few days, you'll have healed up all those fibers, and then you won't have a herniated disc anymore.
Okay.
And I just wanted to tell you about one client. I got thousands of testimonials, but just this one I'm going to share with you. Because this guy had a stroke. His jaw was off to one side. He had had every treatment they could offer. Came to see me. I said, I'm not going to do all that stuff that's already been done. I'm just going to put these in your shoes, period. I want you to see what they can do for you. In 9 days, his jaw was back in place.
Wow.
And he was brand new, and he wrote me this beautiful letter. I'll just show you the letter. And a lot of other things got better, too. So that's it for today.
Okay,
I just
thank
showed you what you can't learn in school. It's
Okay.
not taught anywhere. And I want to thank you for being with me.
Thank you.
And have a great evening.
You too.
Bye for now.